Presentation of the University of Alabama in Birmingham Dental Television System. Dental Anatomy. Mandibular first and second molars. A telecourse by Dr. Barry Eisenberg, Dr. Wilson Wright, Jr., and Dr. Michael Hughes. Mandibular first molar. General characteristics. The mandibular first molars are the sixth teeth from the midline and are identified according to the universal numbering system as teeth number 19 and number 30. The first molar contacts the mandibular second premolar mesially and the mandibular second molar distally. The first molar is the largest and strongest tooth in the lower arch. It normally presents 5 functional cusps and 2 well-developed roots. The mandibular molars function with the maxillary molars in grinding. The first evidence of calcification of these teeth is at birth. The enamel layer is completed between 2.5 and 3 years, with eruption usually occurring between years 6 and 7. Root formation is completed between the 9th and 10th year. This tooth has the greatest mesiodistal width of any tooth in the mouth. It is also known as the 6-year molar because of its normal eruption time. The buccal aspect. From the buccal aspect, the first molar is trapezoidal in outline with the greatest mesiodistal width at the occlusal. The buccal is the largest lateral surface of this tooth. The mesial outline. From the cervical line to the contact area, the mesial outline is somewhat concave. From the contact area occlusally, the outline becomes convex. The height of contour is located at the junction of the occlusal and middle thirds. The occlusal outline. The occlusal outline is divided into 3 portions by 2 grooves as they pass from the occlusal surface onto the buccal surface. These grooves are termed the buccal or mesiobuccal developmental groove and the distal buccal developmental groove. The mesiobuccal and distal buccal cusps are relatively blunt, while the distal cusp is smaller, normally lower, and somewhat sharper than the other 2. The distal outline. The distal outline is more convex in the occlusal portion than the mesial outline, but is usually straight to slightly convex from the contact area to the cervical margin. The height of contour is located similarly to that of the mesial, that is, at the junction of the occlusal and middle thirds. The cervical outline. The cervical line exhibits slight and regular curvature apically, but sometimes presents a pointed projection in the bifurcation area. The buccal surface. The buccal surface is divided into 3 portions by the previously mentioned 2 grooves. The 3 portions decrease in size, progressing posteriorly mesiobuccal, distobuccal, and distal. The cusp ridges of the 3 cusps are convex and are separated by concavities containing the 2 grooves. The buccal or mesiobuccal developmental groove extends cervically to a point about midway between the cervical and occlusal margins. It most often terminates in a pit, the buccal pit, but may fade out or bifurcate into 2 angular grooves, which may also fade out after a short distance. The distal buccal groove is located in a concavity between the distal buccal and distal cusp. It runs cervically and slightly distal to terminate at a point in the middle third near the distal buccal line angle. It most often ends in a pit, the distal buccal pit, but sometimes simply fades out. The buccogingival or buccocervical ridge is a broad convexity running mesiodistally along the cervical third of the buccal surface. It is more prominent in the mesial portion and corresponds to the same structure seen in the maxillary molars. The height of contour is located in the cervical third at the greatest curvature of the buccocervical ridge. The root outline. The mandibular first molar has a root trunk which bifurcates to form two roots, the mesial and distal roots. The mesial root branches from the cervical line, curving mesially to the middle third, and then angles slightly distal to a tapered apex. The distal root is smaller and weaker in all respects than the mesial root. Its outline is usually straight, with occasional mesial or distal curvatures in the apical third. Normally, both have some distal angulation, although occasionally they are nearly straight from the root trunk apically. The mesial aspect. From this aspect, the crown form is generally rhomboidal and inclined toward the lingual. Only the two mesial cusps are visible from this view. The surface is wider at the cervical than at the occlusal. The buccal outline. The buccal outline is usually convex from the cervical to the occlusal, with the greatest convexity in the buccocervical ridge area in the cervical third. The occlusal outline. This outline is concave, with the mesial marginal ridge confluent with the mesial cusp ridges of the mesiobuccal and mesiolingual cusps. A mesial marginal groove may be evident in this view. The lingual outline. The lingual outline is straight or slightly convex from the cervical area to the height of contour. From the height of contour, it is quite convex to the occlusal surface. The height of contour is located in the middle third. The cervical outline. The cervical line may be either relatively straight or slightly curved occlusally, but is usually located at a more occlusal level toward the lingual side. The contact area is round to slightly ovoid in shape and located at the junction of the middle and occlusal thirds, slightly to the buccal. The root outline. From this aspect, the mesial root branch is the widest and strongest of the two roots. From the cervical line, the root outline tapers gradually to a fairly blunt apex. It is widest buccolingually and has present a developmental depression on the mesial root surface termed the root concavity, which causes a flattened concave appearance. The lingual aspect. The lingual surface is also trapezoidal in form. Since the crown is widest mesiodistally at the buccal, it appears to taper slightly toward the lingual, allowing portions of both proximal surfaces to be seen from this aspect. The mesial outline. The mesial outline is fairly straight to concave from the cervical line to the contact area and convex from the contact area to the occlusal surface. The occlusal outline. The occlusal outline is usually interrupted by the lingual groove passing from the occlusal surface onto the lingual surface. The mesial and distal slopes of the two lingual cusps, the mesiolingual and distolingual, and a small portion of the distal cusp may be visible from this aspect. The outline of the two lingual cusp tips is more pointed than the buccal cusp tips and they are approximately equal in height. The distal outline. The distal is fairly straight from the cervical to the contact area and convex from the contact area to the occlusal. The cervical outline. The cervical line is shorter mesiodistally and at a more occlusal level than on the buccal surface. It is irregular to straight, although sometimes displaying a pointed projection in the bifurcation area. The lingual surface. The lingual surface presents two axial cusp ridges of the two lingual cusps. They are convex, with a shallow concavity contained in the lingual groove between the two convexities. The root outline. The root outline is similar to that seen from the buccal aspect with a slight angle to the distal. The distal aspect. The distal aspect is similar in outline to the mesial aspect. However, it is generally smaller, especially in the buccolingual dimension. The buccal outline. The buccal outline is similar to that of the mesial aspect, except the slight concavity sometimes present in the middle third is less evident. The occlusal outline. The occlusal outline is shorter than on the mesial, but similarly concave. The distal marginal ridge may be notched by the distal marginal groove, which is shorter but sharper than the mesial marginal groove. The distal marginal ridge is located at a more cervical level than the mesial. The lingual outline. The lingual outline is similar to the mesial aspect. The cervical outline. The cervical line is usually straight, although it may curve occlusal to a slight degree in the middle portion. More of the buccal and lingual surface is visible from this aspect, since the surface converges toward the distal, resulting in a narrower distal surface than mesial surface. The distal contact area is located similar to the mesial contact area. It is usually larger since it contacts the mesial surface of the second molar. It is ovoid in outline, being wider buccolingually than occlusogingivally. The root outline. The root outline from this aspect reveals a gradual tapering to a rather blunt apex. The distal branch, being smaller and weaker, results in portions of the mesial root being visible from this aspect. The distal surface also presents a flattening or concavity. The occlusal aspect. The occlusal outline is roughly pentagonal in shape, with the distal portion of the buccal outline noticeably converging toward the lingual. The crown is wider from this aspect mesiodistally than buccolingually. The buccal outline. The buccal outline is divided into three portions by the two buccal grooves, all of which are convex. The relative width of the three portions decreases distally. The buccal line angles are rounded. The mesial outline. The mesial outline is convex and may be divided into two approximately equal convexities if the mesial marginal groove is present. The lingual outline. The lingual outline is divided into two convex portions by the lingual groove, the mesial portion being slightly longer. The distal outline. The distal outline is the shortest of the four outlines and consists of two convexities separated by the distal marginal groove or depression, if it is present. Cusps. There are normally 5 cusps on this tooth, all of which are functional. The distal cusp is considered a minor cusp, while the mesiobuccal, distal buccal, mesiolingual, and distal lingual are considered major cusps. The mesial buccal cusp is the largest of the three buccal cusps, being rather blunt and rounded. It has 4 cusp ridges and inclined planes. The buccal cusp ridge extends from the cusp tip halfway down the buccal surface. The lingual cusp ridge extends lingually to the end of the mesial groove. It is the most prominent and longest of the 4 ridges. Mesial cusp ridge. This cusp ridge extends from the cusp tip mesially to the mesiobuccal occlusal point angle. The distal cusp ridge extends distally to the buccal groove. The inclined planes are the mesiobuccal, the distobuccal, the mesiolingual, and the distolingual. There are 4 cusp ridges and inclined planes on the other cusps with names similar to those of other posterior teeth. The distobuccal cusp is the smallest of the 4 major cusps and has a rounded blunt tip. The mesiolingual cusp is longer and sharper than any of the buccal cusps. The distolingual cusp is quite sharp, but slightly smaller than the mesiolingual cusp. The distal cusp is the smallest of the 5 cusps and is relatively sharp. Marginal ridges. 2 marginal ridges, the mesial and distal marginal ridges, are evident on the occlusal surface. Fossae. There are 3 fossae on the occlusal table. The central fossa, which is located in the central portion of the occlusal table and somewhat circular in shape. It is the largest and deepest of the 3 fossae. The mesial triangular fossa, located just distal to the mesial marginal ridge, and the distal triangular fossa, located just mesial to the distal marginal ridge. Pits and grooves. The occlusal surface of the mandibular first molar has the most complex groove pattern of any of the mandibular molars. The central pit is located in the central fossa in the deepest portion of the occlusal surface. It is situated halfway mesiodistally and more than halfway from the buccal to the lingual. It is the junction of 3 primary developmental grooves. The mesiobuccal or buccal groove, which extends from the central pit mesiobuccally onto the buccal surface. The distobuccal groove, which extends in a distobuccal direction from the central pit onto the buccal surface, and the lingual groove, which extends from the central pit lingually onto the lingual surface. The mesial pit is situated halfway buccolingually near the mesial margin in the depth of the mesial triangular fossa. It is the junction of the following developmental grooves: the mesial groove and the mesial triangular grooves. The distal pit is located midway buccolingually in the depth of the distal triangular fossa. It is the union of 3 developmental grooves: the distal groove, the distal lingual groove, and the distal marginal groove. The central groove extends from the mesial to the distal pit, passing through the central pit. Mandibular second molar. General characteristics. The mandibular second molars are the 7th teeth from the midline and are identified according to the universal numbering system as teeth number 18 and number 31. The second molar contacts the mandibular first molar mesially and the mandibular third molar if and when the third molar erupts distally. It is also known as the 12-year molar due to its time of eruption. The first evidence of calcification of these teeth is between 2.5 and 3 years. The enamel layer is completed between the 7th and 8th year, with eruption usually occurring between years 7 and 13. Root formation is completed between the 14th and 15th year. This tooth complements other molars in their grinding function. The form resembles the first molar in many respects, although it is generally smaller in all dimensions, more symmetrical, and the least complicated molar in occlusal design. Since the second molar is similar to the first molar in so many respects, only pertinent similarities and differences will be made. The buccal aspect. The buccal surface is trapezoidal, like that of the first molar, but shorter occlusogingivally and narrower mesiodistally. The mesial outline. The mesial outline is similar to the first molar. The occlusal outline. This outline is separated into nearly equal halves by the buccal developmental groove. The mesial and distal slopes of the buccal cusps, the mesiobuccal and distal buccal, are about equal in length. The distal outline. Again, this outline is similar to the first molar, being generally convex and more so than the mesial outline. The cervical outline. The cervical line is similar to the first molar with very little curvature. The buccal surface. The buccal surface presents a buccal developmental groove which extends onto the buccal surface from the occlusal surface. It terminates in a buccal pit or fades out into the middle third. The buccal cusp ridges of the two buccal cusps are seen on either side of the buccal groove. The buccogingival or buccocervical ridge is similar to that of the first molar and is also most prominent in the mesial portion. Root outline. The roots of the second molar are similar to the roots of the first molar, with the following exceptions. They are usually shorter, but with more variation than seen with the first molar. They are also closer together and are often seen with partial or total fusion. Usually the roots have a greater distal angulation than observed on the first molar. The mesial aspect. The mesial aspect is similar to the first molar, except that it is generally smaller in size and more convex in all directions. The buccal outline shows a more pronounced buccogingival ridge with no middle third concavity. The cervical outline is straighter, but also more cervical on the buccal than on the lingual. The mesial contact area is definitely ovoid, wider buccolingually compared to the first molar's round or slightly ovoid mesial contact. It is also buccally located at the occlusal and middle third junction. The lingual aspect. The lingual surface is also trapezoidal in outline, shorter occlusocervically, and narrower mesiodistally than the first molar. The mesial, distal, and cervical outlines are similar to those of the lingual surface of the first molar. The occlusal outline. The occlusal outline is divided approximately in half by the lingual developmental groove. Only the two lingual cusps and their mesial and distal slopes are visible. The lingual surface. The lingual developmental groove crosses from the occlusal surface onto the lingual surface and fades out near the junction of the occlusal and middle third. The second molar's lingual surface shows less cervical convergence than the first molar. The distal aspect. The distal aspect is comparable to the first molar, except there is no distal cusp contour and no distal buccal groove visible. The contact area is centered on the distal surface, both buccolingually and occlusocervically, being wider buccolingually than occlusocervically. Since there is no distal cusp, the buccal surface shows much less convergence toward the distal, and consequently, less of the buccal surface is seen from this view than observed with the first molar. The occlusal aspect. The occlusal table of most second molars is rectangular in shape, but the distal outline is more rounded when compared to the slightly rounded mesial half. Even though the occlusal table is rectangular, the outline from this aspect may bulge at the mesial buccal. This is due to the greater prominence of the mesial portion of the buccal cervical ridge. The buccal outline. The buccal outline is divided into two equal convexities by the buccal groove. The mesial outline. The mesial outline presents convexities separated by the mesial marginal groove if present. The lingual outline. Lingually, the outline is slightly shorter than the buccal and divided into two equal convexities by the lingual groove. The distal outline. The distal outline is slightly shorter than the mesial and more convex toward the lingual. Cusps. There are normally 4 cusps on the mandibular second molar, all of which are functional. They are termed mesiobuccal, distobuccal, mesiolingual, and distolingual, and are thoroughly symmetrical in their position on the occlusal surface. Although all 4 cusps are more nearly equal in size, the mesiobuccal cusp is normally the largest, while the distolingual cusp is normally the smallest. Marginal ridges. There are 2 marginal ridges which are similar to and named similar to those of other posterior teeth: the mesial marginal ridge and the distal marginal ridge. Fossae. There are 3 fossae with their names and locations similar to the first molar, that is, central fossa, mesial triangular fossa, and distal triangular fossa. Pits and grooves. Unlike the first molar, the major groove pattern is much more symmetrical, with the central groove and buccal and lingual grooves combining to form a cross shape, the intersection of which is the central pit. The mesial pit is located near the mesial margin in the depth of the mesial triangular fossa. It is formed by the junction of 3 or 4 developmental grooves: the central groove in its mesial portion, the mesiobuccal triangular groove, the mesiolingual triangular groove, and the mesial marginal groove if present. The distal pit resembles the mesial pit in relative location and is the junction of 3 or 4 developmental grooves: the central groove in its distal portion, the distal buccal triangular groove, the distal lingual triangular groove, and the distal marginal groove if present.